Could a computer help detect a pregnancy complication before symptoms even appear? Could artificial intelligence help assess a baby's growth, identify fetal abnormalities earlier, or make pregnancy care more personalized? It may sound futuristic, but AI is already becoming part of obstetrics in very practical ways. And this is not just about technology. It is about earlier prediction, better monitoring, more accurate imaging, and more personalized care for both mother and baby. So today, in part 1 of this series, let's explore how AI is transforming pregnancy care, ultrasound, fetal anomaly detection, and labor monitoring. Hi, I'm Dr. Spandana, your OBGYN. Artificial intelligence or AI refers to computer systems that can learn from large amounts of data, recognize patterns, and support prediction, diagnosis, classification, and workflow. In obstetrics, this can mean analyzing blood pressure trends, ultrasound findings, blood reports, Doppler studies, fetal heart rate patterns, and electronic health record data. Let's start with pregnancy care. Every pregnancy generates an enormous amount of information. Maternal history, blood pressure, blood tests, ultrasound findings, Doppler studies, fetal monitoring, and increasingly, electronic health record data as well. Traditionally, many pregnancy risks are assessed using individual risk factors. For example, maternal age, previous pregnancy history, blood pressure, body mass index, medical conditions, or ultrasound findings. But one of the biggest advances with AI is the ability to combine many of these signals together. This is called multimodal prediction. It means AI can look at clinical history, laboratory results, ultrasound findings, imaging data, and monitoring patterns together instead of looking at each one separately. This is especially important in high-risk pregnancy care. Researchers are developing AI models that may help predict conditions such as preeclampsia, preterm birth, fetal growth restriction, gestational diabetes, and postpartum hemorrhage. The goal is not just to label someone as high risk. The goal is to identify risk earlier, monitor more closely, and personalize care before complications become severe. Imagine identifying a woman at higher risk for preeclampsia before her blood pressure becomes dangerously high, or recognizing a pattern that suggests increased risk of fetal growth restriction before the baby becomes severely small, or predicting the risk of postpartum hemorrhage before delivery so that the team can be better prepared. That is one of the most exciting promises of AI in obstetrics. It shifts care from reactive to proactive. Another area where AI is making a major impact is ultrasound imaging. Ultrasound is one of the most important tools in obstetrics, and AI can assist with measuring fetal growth, estimating gestational age, calculating amniotic fluid levels, assessing cervical length, identifying fetal structures, and detecting certain abnormalities. Some systems can automatically recognize anatomical landmarks and generate measurements within seconds. This can improve consistency, reduce variability, and make ultrasound interpretation more standardized. A major recent development is AI-enabled gestational age estimation using ultrasound. Instead of depending only on manual measurements, newer systems are being designed to analyze ultrasound images and estimate gestational age more rapidly. This could be especially useful when early dating scans are missed or where access to expert ultrasound is limited. AI is also helping improve fetal anomaly detection. Deep learning systems can analyze fetal anatomy and identify patterns that may suggest congenital abnormalities. This is especially important in complex areas such as the fetal brain and fetal heart. The fetal heart is one of the most challenging structures to assess on ultrasound. It is small, moving, and requires multiple views. AI systems are now being studied to help classify fetal cardiac views, identify whether important planes have been captured, and support earlier recognition of congenital heart disease. Similarly, AI tools are being studied for fetal central nervous system anomalies, where subtle changes in brain structure may be difficult to detect. Earlier detection can provide valuable time for counseling, further testing, delivery planning, and access to specialized neonatal or surgical care when needed. For many families, that extra preparation time can make a significant difference. During labor, AI is beginning to assist with fetal monitoring as well. Doctors commonly use cardiotocography or CTG to monitor the baby's heart rate and uterine contractions. CTG interpretation can sometimes be challenging because fetal heart rate patterns change continuously. AI algorithms can analyze fetal heart rate patterns, variability, accelerations, decelerations, and contraction data over time. The goal is to identify concerning patterns earlier, support timely intervention, and optimize labor management. This is an important area because decision-making in labor is time-sensitive. A system that can continuously analyze patterns may help improve consistency in monitoring and escalation. The most exciting part is that future pregnancy care may not depend on one data point alone. Not just one scan, not just one blood pressure reading, not just one blood test, but the full pattern of the pregnancy journey. Future AI systems may combine ultrasound images, Doppler studies, laboratory results, home blood pressure readings, wearable device data, electronic health records, and patient symptoms. This could create a much more complete picture of maternal and fetal health. In high-risk obstetrics, this is especially powerful because complications rarely happen from one factor alone. Preeclampsia, fetal growth restriction, preterm birth, gestational diabetes, and postpartum hemorrhage are complex conditions. They involve maternal health, placental function, fetal growth, vascular changes, metabolic status, and sometimes genetic or inflammatory factors. AI may help connect these dots earlier and more precisely. So, what does the future of AI in pregnancy care look like? We may see smarter ultrasounds, better pregnancy risk prediction, earlier fetal anomaly detection, more consistent CTG interpretation, and high-risk pregnancy dashboards that summarize complex patient information more clearly. Artificial intelligence is already beginning to transform pregnancy care in remarkable ways as a set of practical tools that can improve measurement, pattern recognition, prediction, monitoring, and personalization. The future of pregnancy care is becoming more precise, more predictive, and more proactive. And this is only part 1. In part 2, we'll move from pregnancy care into fertility and IVF. We'll look at how AI is being used for embryo selection, ovarian stimulation planning, implantation prediction, and even sperm identification in severe male infertility. What are your thoughts on AI in pregnancy care? Which area sounds most exciting to you? Risk prediction, ultrasound, anomaly detection, or fetal monitoring? Let me know in the comments below. And if you found this video helpful, don't forget to like, share, and subscribe for more evidence-based women's health content. Thanks for watching, and I'll see you in part 2. For more Doctor Explain videos on pregnancy, fertility, IVF, and women's health, subscribe and stay connected. Always consult your doctor for personal advice. Thanks for watching.